The adoption of technology in healthcare over the years has led to a better diagnosis and treatment of patients. Out of all the benefited sectors from technology adoption, healthcare is probably the most important one. Consequently, it improved the quality of life over time and it has saved many lives. So, the benefits of information technology in healthcare or health information technology, as else called, are plenty. To begin, IT enables health practitioners to store and retrieve data relating to patients' records, and also it enhances the communication of patient information. Under health, we have this e-health. So e-health refers to the use of information and communication technology in healthcare. So during the pandemic, there are different teleconsultation services. Example is the one that our former Vice President Lenny Robredo launches a free medical teleconsultation services. So these services is accessible by free data and is meant to serve COVID or non-COVID patients. So if we need to talk to a doctor, we can access their FB page, the Bayanihan e-Consulta Facebook page, so that we will know or we can ask support from healthcare workers. And another thing is there will be having a better electronic records, faster retrieval of our health records, and like if manual, which is placed in a folder, it consumes time to get the record. Also because of e-health, we have the new treatment options and telecare. The World Health Organization defines e-health as the cost-effective and secure use of information and communication technologies in support of health and health-related fields, including healthcare services, health surveillance, health literature, and health education, knowledge, and research. So, clear evidence exists on the growing impact that e-health has on the delivery of healthcare around the world today and how it is making health systems more efficient and more responsive to people's needs and expectations. In a broader sense, the term e-health exemplifies or illustrates the technical progress to expand healthcare locally, countrywide, and universal by using information and communication technology. Examples of e-health include communication with healthcare professionals via email, access medical records, and research health information. So, how digital health is bridging the healthcare gap in the Philippines? So, in Southeast Asia, the Philippines has one of the lowest per person healthcare spending, yet we are the second most expensive in terms of medical expenses in the Southeast Asia region. So these problems are compounded in remote areas by the lack of medical facilities and infrastructure, high cost, lack of medical professionals, and a rise in a mortality from chronic and infectious diseases. So, under these circumstances, insurance costs, including healthcare insurance, become too expensive for the average Filipino. So now, we have here the mHealth or mobile health. So mHealth is the use of mobile devices such as cell phones and tablets to support medicine and public health. So it is backed by a WAH or the wireless access for health leverages the high penetration for mobile devices in the Philippines, low-cost tablets and smartphones, and open source software. So Erin Levine, a project manager, describes it as a 3G technology to improve healthcare by reducing the time required for reporting and improving access to accurate and relevant patient information for clinicians and government decision makers. So using mobile technology helps a lot in making positive impact on basis health services. The WAH has not only helped to track patients' data and provide timely and accurate information to the DOH, but it has also aided medical workers at local health units. So it allows them to access records very quickly, which allows them to expedite treatment, and the collective database of records means that analysis of health disorders and disease outbreaks can be determined and managed more quickly. In addition, the efficiency and capability of the systems makes health workers feel more professional and respected by their patients. The project has expanded the CHEATS EMR platform that supports data collection and reporting from the barangays or local government unit through the mobile midwife platform and sends patients alerts via SMS feature. The research program includes the SMS telereferrals used by the DOH in its Doctors to the Barrio o DTTB program and health education programs giving mobile phone or users reminders on vaccination, dengue prevention, tuberculosis, and health seminars. So we have also here the RCHEATS or the real-time monitoring of vital maternal and child health system. So this is the project uses SMS for field workers to report maternal and child health services rendered, create appointments, and remind patients. So the main concern of the project is the health of mothers and children in the Philippines. The project trains public health workers in using cell phones and computers to report health data. The data collected will go into a server and displayed into a dashboard through which decision makers can see the real-time maternal and child health status of a site.